Good evening, everyone. Thank you so much for joining us tonight. And I have some amazing panelists with me. For those that don't know me, my name is Becca Cato, and I'm the Director of Racial and Social Justice and Advocacy with YWCA Delaware. And I do apologize because I'm also letting people in at the same time. So forgive me if I'm tapping while we're doing this. Admit all. We just want everyone to come. And so our two panelists tonight we have Brittany Williams, and I will tell you a little bit about Brittany, and then we'll learn a whole lot about her as we go through. Brittany Taylor Williams is the founder and CEO of the Black Girl Health Collective and Black Girls Health Con, and a seasoned public health administrator with a passion for equity within care. Possessing a master's of healthcare administration and public administration, she brings 16 years of leadership experience in the federal public health and nonprofit healthcare sectors, supporting organizations as an operation and content expert. Mara Gorman is the public affairs manager for Planned Parenthood of Delaware and a longtime champion of structural equity and reproductive rights. Prior to joining Planned Parenthood of Delaware, she was the volunteer state chapter lead for Moms Demand Action in Delaware, working in communities up and down the state to end gun violence. She has 2 college-age sons and lives in Newark with her husband. All right, so we're going to get started. I'm just going to enter a couple more people into the room, and then we'll get started. So what we're going to do is we're going to have kind of a conversation, Mara, Brittany, and I, and then the last 30 minutes, we're going to kind of open it up for you guys to share or ask questions or anything that you might want to talk about. So I know that some of you were working on the challenge and some of you aren't, and that's totally fine. To start off, I would love for everybody to put in the chat what their definition for reproductive justice is. Don't Google it. Don't chat GPT it. And you just, put it in there. I'm not going to call anyone out. I'm just kind of curious as to the base of where we're starting with that. So if you guys take a couple minutes and just pop in what you think that is. Nice. Right, you guys should go. All right, let's see. All right. Hey guys, pretty good. If you feel free to keep putting them in there if you'd like. I would love for Brittany to share your definition, if you don't mind. I would love to just kind of reproductive justice.
Sure. Hello, everyone. So I would say that for me, I lean into Sister Song's definition of reproductive justice, and they define it as the human right to maintain bodily autonomy and to choose to parent or not parent your children in a safe and sustainable communities. So for me, that's the definition that I lean into when I think of reproductive justice.
Thank you. And that's the one I use too. I think it's good. And I think it's a Sister Song. Not everybody probably knows what Sister Song is. And I'm trying to think, it was 1994 that a collective of Black women got together. And at first they were called, I'm going to forget. It became Sister Song, and they went forward to talk about define what reproductive justice is. And you guys did a good job. I think everybody kind of knows the bodily autonomy part of this, right? But there was another sentence you said after that. The choice to have children, not have children, and then you talked about safe community, safe and communities. Could you talk a little bit more about that?
Sure. So when I think about health and I think about the right, I think about all of the various intersections that that influence your ability to have autonomy, your ability to have access to health and care. And to me, that looks like a sustainable, safe environment, somewhere where you're able to be able to have your needs met, not only economically, but health-wise and related to care. And when I think of health, I often think of community. I think a lot of transformation happens in community. So I think that's a big part, that's a big piece to me that often sometimes people don't really think about when speaking about reproductive justice and those intersections, but it's an integral piece.
Thank you. And Mara, um, good evening. So Mara works for Planned Parenthood, and I would love to know what definition you guys use. Is it the same one for reproductive justice?
I think it is. I think that's an excellent definition. I would also kind of throw in there, I mean, just to elaborate a little bit on the intersectionality piece, because that is so key to reproductive justice. So we're talking not just class, not just race, but gender, identity, immigration status, sexual orientation, all of those things come together. And, I will say also that, there's been a lot of conversation in the past about reproductive rights or choice. And the reason that the term reproductive justice came about was because white feminism did not recognize that not everyone had choice, even if you made all these things legal. And I would say I hear often about Delaware, well, Delaware's safe or Delaware's good. And my answer to that is until every single community member has access to the same care, where there's true healthcare equity, it doesn't matter if it's legal or not. And to me, that's a key piece of reproductive justice is everyone having access to the same high level of care and community and getting to make their own choices.
Absolutely. Yeah, thanks for that. That's very valid. I always like you said, I go from choice isn't really a choice without access. Right. And I mean, we can have all the choices in the world, but if we don't have the opportunity to actually utilize them, they're not going to really move us along. So, all right, let's look at our questions. Actually, Brittany, if you wouldn't mind telling everyone kind of what you do, why you started your organization, because I think people would really like to hear that.
Sure. So I started the Black Girl Health Collective originally in 2021 as honestly a hub for information, especially when Roe v. Wade was rolled back. I really was looking for a place for people in community to have access to be able to find culturally competent and humble providers. And after COVID, and then after returning back home, because for a time I was living in Connecticut supporting work there, I decided to move home to be closer to my family. I was looking for a primary care provider, and I happened to reach out to my old practice, and they weren't accepting any patients. And so I started calling around to kind of find out like where could I find care, and I've actually found one of my old providers that had switched practices and had moved to Newark, and they had an appointment available, but it was a year out. So I realized how terrible access was within my own home state. And a few other things happened. I had family members that underwent health crises. So it kind of prompted me to re-envision what I wanted the Black Girl Health Collective to be. And so we are kind of, we have multi-format programming. And what that looks like is that we hold a large scale conference once a year. One was we had our first Black Girl Health Con last year in 2023 at the Chase Center. We had about over 300 attendees, and we had different tracks, tracks for providers, community, kind of just to meet in fellowship and community and learn. We wanted to break down those kind of barriers and also create a space to kind of amplify the programming and things that were happening, because what I do know is that there's a ton of really good programming out there, but a lot of the work happens in silos. So how can we kind of reevaluate and reimagine how we look at health? So that's one thing. We also provide programming throughout the community and partner with different organizations to provide learning experiences. We've done a pop-up, and we had a menopause brunch where we talked about the different stages of menopause and the impact. We talk about all of the different things. Even though my wheelhouse and my bread and butter is reproductive health, we cover chronic illness, prevention, mental health, LGBTQIA issues, and challenges, and just a wide breadth of experiences and information. So we do virtual, we do in person. So we have a lot of different formats for the work that we do. And we really want to ensure that our work is expansive and inclusive.
Awesome. Thank you. And I did put Brittany's her website in the chat if you'd like to take a look at it. Not right now, but save it. And you know, if you want to support her work in any way or reach out and ask her how you can do that, feel free to do so, because she does really important work. Mara, what about this time frame? So I read a little bit about Mara's bio, and she at one point was the lead for Moms Demand Action, and now you are with Planned Parenthood, and I know that was a volunteer position, but what made you kind of decide that you really wanted to kind of move into this advocacy space?
Thanks. That's a great question. You know, I will say that to me, the Venn diagram, like with gun violence and the communities of care that we are involved with, is they're basically two circles stacked on top of each other in a lot of ways. You know, when we're talking about reproductive justice, it's about, you know, things that have a negative impact on communities, like overcoming those things. And gun violence is definitely one of those things. And then another thing is not having access to care to be able to make decisions about your health, about your family. So the combination of those two things, like to me, it feels very logical, like it's not different. You know, at Planned Parenthood, we are part of the community. We are partnering with other organizations that are seeking economic and environmental justice. We're giving support to them, you know, shoulder to shoulder. And that was what I did in Moms Demand Action. So it feels completely seamless. And, you know, as a woman and a mother and a person with a body, like I care about those issues, as everyone should. And I have, you know, children who are moving into adulthood and are going to be making, you know, have partners and be making decisions like that themselves. And I've always cared a lot about young people, and they are so impacted by everything that's happening in this space right now. So I think that for me, it feels kind of like I've just continued on a journey. You know, I started in one place focusing on gun violence. Now I'm working with some of the same people, and, you know, it's under a slightly different umbrella, but really I'm caring about the same things, which is the community and the people in it.
Yeah, no, that's good. Like it's seamless, but it kind of, I just think sometimes things are more top of mind, topical nationally.
Yes.
And that is, you know, we're lucky to live in Delaware, but I know that some of these individuals on our call tonight are from outside of Delaware.
Mm-hmm.
And so while I feel, you know, safe here at the moment, I know that there are individuals across the country right now that are really scared. And so thoughts, Mara or Brittany, about, you know, how Delaware can help support that right outside of our space across.
So I would say, I mean, it's funny because I would say on the one hand, be a little scared, like that's not wrong. I say that about the gun violence piece too, like that, be vigilant, be paying attention, because those things matter and you don't know what's going to happen, and things that happen nationally could impact us here in Delaware. We're certainly not immune. We know that, for instance, what the Supreme Court rules on mifepristone use will have an impact on abortions in Delaware. So, but I would say in terms of the national conversation, one thing that Delaware can, and I think is contributing, is we can be a leader and we can actually provide the care. So after Dobbs, I know that Planned Parenthood Delaware, I didn't work there then, but I know that they started ramping up right away to be able to provide care to people who needed to come from out of state. We're also supporting legislation about gender affirming care, because that is one of the services that we provide also. We're supporting legislation that would make sure that providers can give care to people who come from out of state, and not have any negative consequences to them, not be prosecuted, and that they can use telehealth. And we already passed legislation that would do that for abortion care. And now we're trying to do it for gender affirming care as well. So
Wow.
there are policy things that we're involved in that, make us a good neighbor and make us, not just to Delawareans, but to other states. And then in Delaware, we're really focused on bringing care to as many people as possible and making sure that people know that we offer, STI and HIV testing and PEP and PrEP and behavioral health and reproductive wellness and all these things, prenatal care in Newcastle County. I think a lot of people don't know that we have prenatal care. So it's, we're not focused just on abortion care. We're proudly offer that and offer it safely and offer miscarriage care, but there's a whole spectrum of things that we do. And the reason for that, again, returning to the idea of the whole point of this conversation, is to make sure that everybody gets the care that they need.
Thank you. To that point, I think, Brittany, when you were talking, you talked about the community support, and obviously that's something that we can't give most likely to people outside of Delaware. So how in Delaware can we support the community? What are ways that we can do that, Brittany?
So as I was listening to Marge talk, I was thinking about all of the different things that Planned Parenthood does offer. And a lot of people aren't aware of all of the all of the different supports that Planned Parenthood offers to the community as far as care, right? Like there were a few comments in the chat. I just want to acknowledge that someone had put in, as a transgender woman, healthcare can be extremely frustrating. Those things don't change, right? Like that is reflective of healthcare across the spectrum, across all states. And what I think that we can do here to kind of be more vigilant and support the work on all of the intersections, whether it be racial, gender, identity, all of the things, is be better stewards. And that means being better community partners, being better supports, staying vigilant, being really tied into the community and being a part of it, right? Because doing good work means being in community, right? And it means not necessarily focusing on reciprocal relationships, because it's not always that. It means showing up no matter what. And so how we can be good stewards is knowing the landscape, knowing what's happening in our neighboring states, and then also funneling supports and funds and all of the things into our community. One of the things that we haven't touched on, because sometimes abortion comes up, is self-managed abortions and what the landscape of that looks like, especially within Delaware. People are going to be wondering how to, because of the things that we're talking about, because of the possibility of, or concerns around legalities, wondering what the landscape looks like and if that is an option for them, and how to self-manage at home because of these things. So to me, being vigilant and being in community looks like all of those things.
Yeah, thank you for that. That's very true. Because your organization has a very holistic approach, which is how we serve people, right? Holistically. YW has a home life shelter, and we try to do wraparound services, right? Like, people don't just need one thing, especially when they're going through some of these things.
Our director of operations will often say, that at Planned Parenthood, that is really our model of care. So someone will come in and they're coming in for STI screening, and they leave with an IUD that they didn't even know was possible for them to get or good, would work for them. And so I would say that's part of the Planned Parenthood model, is to make sure that we do a real needs assessment with people and make sure that we have a full understanding of all of their needs and either refer them elsewhere, if we don't provide the care that they need, or, surprise them by saying, well, we have a licensed clinical social worker on staff. Do you need someone to talk to? And I just think that, the more that we can offer that kind of care, the more we're looking toward a more equitable model, right? Because I think people with money and resources and insurance can go to all the different specialists that they need to, but the people who maybe don't have those things, or who live in communities where there might be stigma attached to a variety of the things that we offer, we're offering privacy and holistic care and care, right?
Right.
Like we care about you as a human.
Yeah. Yeah. I think that's the way we really have to go. Just serving individuals. We kind of just said that. Give me one moment. I want to see what I have.
No, you're fine. I actually was going to follow up with what
Please.
Mara was speaking about in regards to like the referring out thing. Referring is a very important part of care, because when you're unable to treat for something or be able to speak to that need that a person has, those relationships between organizations and their referrals is very important. Being able to have a relationship and give a soft handoff to someone instead of just a list is very important. Knowing the resources within the community is very important. And I think that also plays a role in what it looks like to be in community with other organizations, and move the work of intersectionality, visibility, partnership, all of the things forward.
Absolutely. So I think I was going to talk a little bit about, and this can kind of go to both of you, but the lack of trust, and we did some of this in the challenge, but the lack of trust in the healthcare field for people of color, and a little bit of the history of that. Now, if you participated in the challenge, they talked about the syphilis experiment, which I did not realize it was as many years as it was. But that's just one instance of, you look at Native Americans and how many hysterectomies during a certain period of time were without permission processed on individuals. So can we talk a little bit about, why, even within Planned Parenthood, why because Planned Parenthood, a lot of times people think of it for white people. Just generally speaking, it is not. And our Planned Parenthood has an amazing African-American woman leading it. But I think people kind of put that in a box. But what are those other things, like historically, like why might people think that? And why is there this anxiousness?
Well, I can speak to that. It's anxiousness because it's a thing when you look at the history of I want to say specifically for me thinking about like reproductive justice or reproductive, justice or bias and coercion, and the long history of the complicated relationship that systems within the United States have had with people of color. It's horrifying. I don't really have any other words for it than other than horrifying. And if you talk to many communities of color, almost instantly, any person that you talk to may know someone that was impacted by some system or someone that has been harmed by a system of care. So a lot of these stories that you hear, a lot of people may go and think of and speak to like the syphilis experiment, but there also was a birthing control experiment in Puerto Rico. There was forced sterilization, things that are happening almost like to this day when we're talking about undocumented communities in near the border. Like there's a reason that the angst and, you know, these fears exist in our community. Someone in the chat was speaking about the maternal mortality rate for Black women. It's not only in Pittsburgh, it's across the country. And it doesn't matter your economic status, it doesn't matter your education, you're just at a higher risk of dying in childbirth. So the reason that these angst and these fears exist is because there is a history of harm in Black and Brown communities. There's a history of Black and Brown bodies being put up for experimentation for the advancement of, you know, medical systems and knowledge. And yes, and someone said something about like incarcerated loved ones and folks as well. Like there is a history of a lack of consent. People weren't even able to give consent to be in these spaces. When I think about, someone said Henrietta Lacks, absolutely. Henrietta Lacks. And so the list is really long. And I think if anyone wants to read more and learn more about it, there is an amazing and incredibly long book, and also very heavy. But I would recommend Medical Apartheid. It is a large and very horrifying book, but it chronicles the history of a lot of experimentations in the United States, and the impact that it has had on communities. So I think that is where a lot of the distrust, well, I know that's where a lot of the distrust comes from. And then, you know, just knowing that there is something such as segregated care that exists in this country today. Like it does not matter, again, your economic status, your background, it is a thing. So there's an impact and it is lasting. I don't think it is the work of the communities to be able to bridge that gap. I think it is the work of the systems to implement change and make sure that we are, you know, supporting communities and providing care in an equitable way and culturally humble way.
I'm just going to do a quick follow-up on that.
Sure.
Mine just went blank. We are talking about past. What is something that you kind of like tell people or guide people who are kind of you know, untrusting, right, in the system, and there is a lack of gynecologists and OBGYNs across the country, across our state. So looking for someone who looks like you is even harder. So what is something that, like, do you have, or do you just kind of connect with people and make sure they're getting the support they need if you have to refer out, or do you have the connection with individuals that you know, refer people to, so you know that they're getting the care that they need?
Sorry.
Oh, no, you're fine.
Sorry about that. It's really good, great question. I think my dog Baldwin wanted to answer that. But no, that's a really great question. I would say that, and what I say often to people that are fearful is that when they are in any space with a provider, there are two experts in that space. You are an expert of your lived experience, and the provider is the expert of the latest clinical care, and they're supposed to be making a decision. You're supposed to be in that space to make a decision about your care and partnership. So it is not a one-sided thing. I often also say about advocacy, if you don't feel like you're getting the answers that you need, or you don't feel like you understand exactly what is being shared, making sure that you advocate and express that, and don't kind of, because we have sometimes the perspective of kind of backing away because of that power dynamic. And if you don't feel like you are in a space where you can advocate, bring somebody with you, somebody that you trust that can be in this space. There's plenty of organizations out there that support with patient advocacy. and help in those situations. And also, I just want to lift up that there's a certain level of privilege to be able to, find support or be able to say, I don't feel comfortable with this provider. I'm going to find another one. Like I shared earlier in the conversation, when I moved back to Delaware, it was a year wait for a provider. So it's really hard. I know people that have been harmed by systems and providers and haven't been able to seek care somewhere else because there is no more access in the area, and going outside of the community where they reside would be a hardship. So the first thing I would say, try to navigate within the system, and advocate, and then also realize that your experience and what you bring into the space is just as important as any provider.
Yes, thank you. Mara, did you have a
I
tremendous
would just add that, Planned Parenthood has had and continues to have to reckon with its own history around these issues. I mean, Margaret Sanger, who founded Planned Parenthood in 1916, was a nurse, and she did a lot of amazing things, and she was also a eugenicist. And, that is something that we have had to answer for and continue to answer for. And, the head of our organization now is a Black woman, and she talks pretty openly about it. And she says, Planned Parenthood has privileged whiteness. We've contributed to the harm of Black women and other women of color. And we haven't always been as understanding about like women's health, right? Like we've harmed non-binary and trans people. So, I'm a big believer that you can never apologize too many times, and you can never stop working. I think it's really important to never stop working on cultural competency and be humble. I love the word humility. Like, I just think that's so important. And the caregivers that I know that I get to see now that I work with, I think they do have that humility. But also, we're relatively small. So, right. So we're like operating in Delaware. I will say we definitely have appointments. So if people are looking in Delaware to get some care, we have clinics in all 3 counties. There are 4 of them. And I would certainly invite you to reach out to us, and to make an appointment. But, I just really strongly believe that listening to patients and to the people who come through the door is really important. And I think that the people that I work with also feel that way. But it is true. I mean, we do have to reckon with, what we did, and it is not the responsibility of the people who were harmed to make us, feel any kind of way about that. Like, that's our job.
Right. Thank you so much. And I'm so glad to hear, that Planned Parenthood is kind of, talking about the history and trying to move forward. I will tell you in our audience here, Dr. Margaret Chou is with us, and I had originally asked her to be a panelist and I hadn't connected with her. So she's here. You, Brittany and Mara, mind if I bring her on?
Absolutely. Welcome, Dr. Chou.
Hi, Dr. Chou. Always happy to hear what you have to say.
I don't know if you are familiar with the ladies. Obviously, Mara, Dr. Chou. I'm just going to give everybody a quick bio about you. You are medical director of obstetrics of the Nemours and Christiana Care Advanced Delivery Program, which helped develop collaboratively with Nemours AI DuPont Hospital for Children, establishing administrative, operational, performance improvement, simulation, and safety protocols for healthy mothers-to-be of infants anticipated to need specialized intervention shortly after birth. And I know you do more than that, Dr. Chou. So
I do. And actually, it's just a Nemours program now. Christiana got it started, and now we're just Nemours. But I'm actually probably not supposed to say, because I'm not supposed to speak for my employer in this space. But I'm the immediate past chair of Delaware section of the American College of Obstetricians and Gynecologists, and in that role, I do a lot of work with some of the advocacy in the reproductive health space.
Wonderful, and that's a perfect segue in that we were just talking about lack of care. And I know that I attended an event, and you might have actually been speaking at it, Dr. Chou, down at Legislative Hall talking about the lack of access to OBGYNs and you just can't get an appointment, like Brittany said. Can you talk a little bit about that and your experience in that space?
Sure. I would say that, you know, in ACOG, we usually talk a lot more about the things that our patients need. I think we, you know, we can bear witness to the lived experience of our patients. And because we come from a position of privilege, we can speak to people in power and say, this is what we're seeing. And you need to pay attention to Black maternal mortality. You need to pay attention to reproductive rights. You need to care about gender affirming care. You need to care about LGBTQ clients. And like you know, that's our, I think that's our job. But I think what's really hard is that there are pressures to medicine. And, you know, again, we're speaking from a position of privilege. I acknowledge that. But for those of us who are here, over time, it's gotten a little harder. It's gotten a little stressful. And there are many of us who retired or many of us who left the profession. And so that leaves fewer and fewer of us in the state. And so, you know, as somewhat humbling it is to sort of have to speak for yourself, you know, we've had to kind of say that and just say, you know, we're not speaking just for ourselves. We're also, again, speaking for the people we care for because they don't have access to care anymore. You know, I think right now, if you call and you say, hey, guess what? You know, I found out I'm pregnant and I need to talk to the doctor about this. And, you know, you're trying to sign up for prenatal care. You may not actually physically meet the doctor until 20 weeks along. And a pregnancy is 40 weeks. So
Halfway.
yeah.
Wow.
So
Wow. Yeah. That's a problem. And I think one of the other things that I learned at the event that I went to is the cost of insurance for being an OBGYN gynecologist has skyrocketed in the last several years, which makes it harder for a doctor, one, to choose that, right? And then to practice it. Can you talk a little bit about that kind of jump? And
it's hard. I think it's hard. I think that malpractice insurance is what it is. And I think that makes it difficult. If we thought that we had any kind of chance to really have a conversation about that, like in other states we do, but in this region, it's not realistic. And so we, you know, that's not an area right now that we think we can put our efforts into change. And that's okay. That's okay. It just is one of the other pressures that just sometimes makes it hard for the young physician to choose to be an OBGYN. Those of us who do it now, I think we just do it because it's in our blood. I don't think I could ever do obstetrics. I you know, you probably can't tell I'm a little gray, but you know, I love it and I can't give it up. But I do think that it's a little hard. The prospect of it when you hear about it and you're not committed to it yet, sometimes that makes it difficult.
Yeah. So I'm assuming in Kent, Brittany, it's probably a little more difficult. I mean, we're up here and where all the doctors are in Newcastle County. I shouldn't say we. I know that Mara is, and I'm assuming Dr. Chou at least works up here.
I'm in Newcastle County right now, but actually I practiced for years in Kent County.
Did you?
Yeah, like about 10 or 11 years. Yeah.
Okay.
That was my first job out of residency, and that's what brought me to Delaware. Very fun.
Wow. Wow, you stayed. That's awesome. That's awesome. Most people
and
don't.
that most people don't. A lot of people don't. I mean, and that's also a big thing. All of the things that Dr. Chou was just touching on are things that absolutely keep me up at night, especially coming from Kent County, knowing that the patient load for practitioners here is like 1 to 2,200, which is pretty much like double the average that a primary care provider should have. We also actively have healthcare practitioner shortage areas throughout Delaware. And there are a couple of things that come up for me that like I said, keep me up at night. And one is the lack of providers and knowing that we don't have any medical schools here. So all of our practitioners are transplants into the space. And with the rising cost of like living, it's not necessarily a hot spot for
Right.
providers, right? Like we would have to look for a certain provider, like a lifestyle provider, a provider that's interested in this kind of area. And then another thing that comes up for me is the rise of concierge care. We already have disparities in segregation of care, and now we have another level, another area, another, you know, thing with this concierge care where which is great if you have access and the privilege to be a part of these practices where you have, you know, a larger amount of time with your provider, access to your provider, whatever. But if you don't, that means that you just don't have that level of access. And what is the impact of that? So these are the kind of things that keep me up at night, especially thinking about my home state and you know, access to care, because I think we have a major issue in Delaware. So when we're talking about reproductive rights and autonomy, people have to have access to care to even be in the space to have conversations about that. And if people don't have access, they're self-managing. And what is the impact of self-managing?
Yeah, absolutely.
Brittany, I don't know if you want to talk a little bit too about stigma, because like, so for instance, at Planned Parenthood, we have a clinic in Seaford, we have a clinic in Dover. And again, I'll say, we have appointments at those clinics, like people are seeking care. That's a place they can call, right? That's a place that they can go to. We are there for them. Our motto is literally care no matter what. But I do worry sometimes in some of the communities, like if you offer reproductive care, there's pressure, or, you know, people don't want to be seen, especially if the clinics are small. And I'm like thinking about like Dover, Seaford, which are kind of like small towns. I mean, I know Dover is the state capital, but it's not big and the clinic's not big. So like, what are things that we can do as a community to help people overcome that, right? And get the care they like, go to the places that are offering the care and not be concerned about, you know, I don't know what their families think or their neighbors think. Like, are there things we can be doing as providers to improve that? You know, I just think that's a part of the conversation that, and even in Wilmington, like, I feel like we could improve on that.
Yeah, I think that's one of the things. Most people don't know everything that Planned Parenthood does. I think everybody goes to think, you know, your right to choose, which is a very important part of their platform. But like you mentioned earlier, you do transgender affirming care and counseling.
Yeah, we have behavioral health care, we have gender affirming care, we have in Newcastle County, we have prenatal care. And we, you know, when people come in, we also, I think, do some of that wraparound work when we can, and we refer people out, you know, generously and in a caring way. So I would love to see people, especially in Kent County and Sussex County, taking advantage of that, because I do, you know, we are small, but we're there. And I know that there's not a lot of other providers. But I do think this whole issue around some of the stigma, I do think it can be a little problematic. I don't know if you have thoughts about that, Brittany.
Yeah, no, absolutely. So there is a ton of stigma, unfortunately, with Planned Parenthood just based off of the history. And I would actually say a lot of the stigma and conversation about Planned Parenthood and the history of Planned Parenthood has ramped up ever since I would say since Trump was in office. I was seeing more of a conversation of like Planned Parenthood and the impact on Black and Brown communities trying to be weaponized by people that had an agenda against Planned Parenthood. And a lot of that is because Planned Parenthood is just a good target, right? A historical target, I would say. And people aren't really familiar with all of the different programs and care that is offered in Planned Parenthoods across the country. Planned Parenthood in Connecticut, I mean, a lot of them offer primary care, like a whole plethora of services. So I think part of overcoming that stigma and bias is being within the community. I've gone to, in doing that work of advocating and educating, because when people know that there is a pathway to care or are given the tools and resources to understand more about their care, they're more likely to use that. And that's like shown by studies. So anytime that I'm in a space to educate or being, a former Planned Parenthood head, any space I'm in and I have the ability to communicate about the work that Planned Parenthood does and kind of shift the mindset around understanding the history of the organization and where it stands now, I take the opportunity to do so, because a lot of times people just don't know what they don't know. And a lot of that work is, like I said, being in the community to show a pathway to access to care, and elaborate more on understanding exactly what programs and services we do offer.
While we're there, I would love for you, some of you on this call may be very familiar with doulas and what they are, and what they do. Brittany, and then I'll go around. If you could talk to what a doula is, why they're important, why they work, in statistics, why that can help someone, or individuals in the Black community.
Sure. So we talked a little bit earlier about the Black maternal mortality rate. And historically, there's been studies that show that when Black women have doula support during a pregnancy, they're less likely to endure or experience complications. A lot of times doulas are not direct care providers. They are literally advocates and supports. So what it looks like is having a support. It can look plenty of different ways. And I also want to be clear that there are different types of doulas. There is not just one type of doula. There are birth doulas. There are postpartum doulas. They are also abortion doulas. There are death doulas. But specifically when we're looking at like the reproductive kind of justice framework, a lot of the work falls within, birth and prenatal, postnatal doulas and abortion doulas. So they're really important to, I would say any community, but specifically communities of color, because there often is a need for support and advocacy, support and advocacy in our communities, support and advocacy in our communities. So they really bridge that gap between provider and patient.
What is a doula for those that don't know specifically? Like, what does a doula, I mean, you just talked about what a doula did, but like they go through training, right? And
oh yes, absolutely. So there are different types of doulas. Like I said, doulas often go through some of them have really intense trainings. There are different types. Some are certified, and what that looks like is for a period of time you go through a training. You may often work under a organization that will certify you to have a certain number of births or supports. There are doulas that offer prenatal postnatal support, so that you are able to sleep. They sometimes can prepare meals. They can support in a variety of ways. And really it goes back to like that community support that was existent. Like, I feel like we're kind of shifting back into like communal support, especially for dealing with like Black maternal mortality rates or these different gaps in care. And so doulas really bridge that gap. And whether it looks like for abortion care, prenatal, postnatal birth, all of those different things, doulas are really right at the foundational piece of community and support and care. And recently in Delaware, legislation just passed so that doulas are now eligible for Medicaid reimbursement.
yes, that's
And
awesome.
then we recently also expanded some of their role in postpartum care. So
Yes, we're gonna talk policy in a couple minutes. But Dr. Chou, do you have experience with doulas?
Of course.
Yeah, and what is that helpful to you to have someone that focuses on the patient specifically?
I think there are all sorts of doulas, and I would say the most positive most positive experiences I have had have been where, I feel like my patient, I actually recommended one to one of my patients once. She came to me in a very difficult situation, and I felt maybe her support person was a little bit about themselves, wanting to show what a great person they were for helping this person who was in a bad situation. And I thought it was really nice to have someone who was a little bit more neutral and really just focused on helping this person. I certainly think that there are definitely people who there's a whole history, even if I've never felt that I've perpetrated systemic racism on someone, it's impossible as a physician not to acknowledge that that's there and that you're part of it because you're part of the greater system. And I would say that it's really hard. There's some women, particularly Black women, who don't want to be perceived as the angry Black woman and stifle themselves or feel that they're stifled in speaking in sort of a medical context. And I think sometimes that doula is very helpful because it sort of changes the narrative. It sort of changes the interaction. Then it's not, then it's correctly centered on supporting that birthing person. Right. And I do think that can be incredibly helpful. I think that it's really important to note they're not medical personnel. So sometimes there's always a history in the past of if doulas have a particular agenda, then again, I feel like then they're not helpful. But if they're helping the patient speak for themselves and express what they want, I think that's so important. And I think that's a beautiful thing.
Yeah. And I think that might change with some of the policies because individuals who are really good at that will now be able to get reimbursement. So Mara, I'm going to go to you. What have we done?
Follow up
Oh, please,
I'm
please,
sorry,
please, Brittany.
Becca.
No, you're
sorry.
okay.
I just wanted to follow up with the conversation about doulas, and then also share that there are doulas that specify in trans and queer families as well. So and Black birthing people as well. So there is like the doula work is expansive. And we know not just like Black and brown communities, but those intersections of trans and queer folks that experience disparities as well and harm within systems, especially birthing. So that's also a way that doulas come into play within the community and providing care and support and advocacy.
Yes, absolutely agree. So Mara, what's going on policy-wise?
So Dr. Chou already mentioned that. So we passed coverage for doulas in Medicaid, and there is a bill right now that's been voted out of the House and is in the Senate committee, HB 345, and that would require postpartum doula care be covered by Medicaid. I anticipate that is going to pass. If it passed out of the House, it should pass the Senate. But in terms of other things that are going on in Delaware, so in our last legislative session, we passed legislation that offer protections to providers who perform abortion care, and expanded the list of providers that could do that. So now there's another bill that has been introduced. Those bills are all sponsored, I believe, by Representative Minor Brown, who is the majority leader.
Yes.
But now Representative Neal has introduced a bill that would offer those same protections to providers who offer gender affirming care. And what that means is, so if someone provides gender affirming care in Delaware to someone who comes from a state where that is illegal, they cannot be prosecuted by that state. They can't be extradited to that state, and that can provide it. Insurance has to cover it, via telehealth. So I think this is a really important bill. It had a rough hearing in the House Health Committee and has not, like, a very rough hearing. So like if anybody the number of the bill is HB 346. Anyone who feels like showing up for the floor vote in support of Representative Neal, the trans community, and the providers who provide this care, Planned Parenthood being one of them, I think that would be amazing. They have not yet set a date for a floor vote in the House. But I was a little taken aback by quite how
I was too.
The House vote.
I was too.
And then the other thing that we have going on, House Bill H234 last year expanded Medicaid coverage from 6 weeks postpartum to 1 year following the birth of the baby, which is awesome. HB 110, which is in the House Appropriations Committee, would require Medicaid to cover abortion care in Delaware, which is very important, frankly, for if we're talking about equity. Because right now, there are people who can't get abortion care because they can't afford to pay for it. Or they come to Planned Parenthood and we do provide it for them, but then it is a cost to us and makes it harder for us to provide the good care to everyone that we need to. So that's a really important thing. You can certainly reach out to your representative and ask them, like, when is this coming out of appropriations? That wouldn't be a bad thing to do. And then I just wanted to point out, because it was brought up in the chat about incarcerated members of the community, we did pass, as part of the bills last year, protections for incarcerated pregnant women. They expanded shackling restrictions from the second and third trimester to 13 weeks postpartum, and extended reproductive care to people who are incarcerated. So we have done some of that work in Delaware. I am certain, I feel to a moral certainty, that there are things in our correction system that could use adjusting that would help everyone. But certainly people who are, need reproductive care of kind of any variety at either end of the spectrum, older, younger. But that is a start and a move in the right direction, and an acknowledgement, again, that that's a population that deserves care. The notion that only some people are deserving of care. I will point out, and I feel empowered to say this, when white women realize, oh no, something has been taken away from me, they act like all of a sudden this is the worst thing that could have ever happened. And it's
Right.
like, there were a lot of people who did not have that before.
Right.
And they're looking at you saying, told ya, like,
Right.
have you seen us? So, a lot of what is happening nationally, if like you feel activated around it, just like, I would invite everyone to step back for a minute and say, hey, like, maybe there were things going on that I wasn't seeing, like pregnant women in prison being shackled. So, like, one of the things that I think when we talk about, like, what can we do, is develop that level of awareness. And again, I think the word humility comes into play here.
Yeah. Thank you, Mara.
Sorry.
I just want to answer the question in the chat real quick. Someone asked what the laws were in Delaware. Delaware back in 2017 codified the right to choose, but it is not in our Constitution. And any kind of constitutional amendment takes 2 cycles. So it's always a bigger hurdle, but I believe there are people that are beginning to work on that if they haven't already.
I think that's right. But yeah, we did codify, Roe versus Wade is codified in our state code. So abortion is legal in Delaware. Yeah.
Thank you for that question. I know that we have some out-of-staters here, and we do a lot of Delaware focused stuff, but it applies to everyone. Are any of you able to speak on IVF? Great. So Chou, you could do a little bit on that.
So there actually is, I don't know whether I should say who's sponsoring it, because I'm not sure whether or not they have introduced it yet, but there is some interest in also extending the same protections to providers of fertility care as is right now present for providers of abortion, and as we're trying to get for providers of gender affirming care. Reproductive health care is reproductive health care. So whether it is terminating a pregnancy or whether it is helping someone to get pregnant, that's going back to our definition of reproductive justice and Sister Song, right? It is about getting to do with your fertility and your reproductive potential what you want to do with it, if anything.
Yes. So thank you, guys. I would love if you had any lingering thoughts before. We're going to kind of open it up to Q&A and people to kind of share information if they'd like. But I would love for you guys to, like, either were there loops that I left out? Was there something really important that you wanted to say? Or to have people, I mean, you'll answer questions as well, but I just wanted to make sure that there wasn't anything on your docket that we didn't get to.
I have one thing I want to say, which is that Planned Parenthood has had a pretty significant change in leadership. We are now led by a woman of color, and it's very exciting that she's there. And she brings, her name is April Thomas Jones, and she's on this call, and that's not why I'm saying it, even though she's my boss, because I really actually believe this, but she brings, and I share this with her, this deep commitment to the community work. And, you know, I agree with you so much, Brittany. Like, I asked that question, but I kind of knew the answer about the stigma. Like, I know that what it is being in the community, showing up, and also listening, right? And talking about, like, listening and then responding to the need. So when someone says, you know, I just can't get prenatal care, being like, oh, well, I just want you to know that we offer that too. And maybe you weren't aware of it, and maybe you have some other issues with us, but I do want to tell you, we have this, you know, this is here for you. So, you know, I am very excited about the direction that we are headed in, as an organization. And I definitely also invite, you know, feedback, not necessarily like in the chat or anything, but just generally, if people are interested, I can share my email. You can certainly reach out if you have questions, or if you work with a community group that might want to partner, you know, you think would be a good partner. We are really, we are part of the community, and we want everyone to know that that is so important to us.
Thank you. Thank you so much for that, Mara. And I know we brushed through a lot of things, but I just want to make sure everyone got the point that, because I didn't know this years ago, Planned Parenthood does regular gynecologic work. Like, so if you can't find a provider, you can call Planned Parenthood. They have providers. They can help you. It doesn't have to be a pregnancy, you know, any kind of, you know, healthcare issues you may have. So, Brittany or Dr. Chou, whichever one of you guys would like to go next.
I can go. I just wanted to follow up on a couple of things that we mentioned, especially around incarcerated individuals. Right now, I believe there is a doula program that is going to be rolled out in Baylor coming forward. So that is a thing that is happening on the back burner. Again, I really wish that we would focus on supporting community organizations already. I think that's really important, especially when we look at these larger systems and the impact and reach, you know, when we're looking for support for navigating, you know, bids and care and programs. And then the other piece is that there is the work that is going to put up abortions to be reimbursed, but also, there's a piece of expanding family planning Medicaid, which has not occurred in Delaware, which is really important. And what that looks like is people being able to get reproductive health. Like, we do have some systems in place, but really expanding that Medicaid family planning is a great way to also catch people that don't have access to care or that are underinsured.
Great, thank you for covering those things. And Dr. Chou?
I saw a question. Somebody asked a question.
Yes, there's lots of questions in here.
Like religious stipulations when it comes to,
Yes.
what did the person, I think that was Kathleen asking.
Yeah, she wanted to know if we had any religious stipulations regarding female reproductive care, I'm assuming. Right. There are some states that you can, well, I don't know if that's national. I think, go ahead, Dr. Chou, you know.
Oh, I don't know whether you were talking about like insurers not being required to pay for certain.
Yes, I believe she was. But Kathleen, if you want to come off mute real quick, you can do so. To clarify your question. Okay. All right. I don't know.
I'm trying to get on. Hold on.
Hey, Kathleen.
Hi. Can you hear me now?
Yes.
Okay. Hi, everyone. I'm actually asking these questions because I'm a local preacher in at Mother Church at UME, and I'm part of the social justice through the UME. I'm a co-chair. And so we're in May, we're having a panel and we're going to be talking about different things. So I actually came on so I can have some feedback for when I go back to the panel and, you know, actually know what I'm talking about. So that's why I was asking like any stipulations or anything, and because it's choice, you know, maybe it's because of the people's religion, whether they want to get it or not. So what I was just saying, like, is that a question on one of y'all's, you know, applications when the people come or anything like that? Do you have like any religious?
So I feel like that is private, and I feel like that is your own business. So when somebody comes to me for care, I mean, I'm a preacher's daughter, right? And I think sometimes, you know, maybe you were raised a certain way and maybe it's very hard for you to make a decision, but you know, you find yourself in a circumstance where that's the choice that you feel compelled to make.
Mm-hmm.
I don't want to make things any harder on somebody who maybe is doing something that's not comfortable.
Right.
I don't
Thank you.
I don't think that's any of my business. On the other hand, if somebody wants to talk to me about it, because
Mhm.
because that is important to them and they have questions that I can answer for them on the medical side, I think that's I honor that.
Well, I just have to say that I feel a whole lot smarter tonight listening to all of you women. So I thank you for Becca, you always sending me different things for me to come on. So I try to join as much as I can. Actually, tonight I am in seminary, so I had a class. So I had y'all on at 6 because the class started at 6 o'clock. So I had y'all on trying to listen to y'all and trying to be in my class and everything. So I was kind of multitasking tonight. But I'm just so glad for all the information that I can take back to our committee.
Great, Kathleen. And I will forward you contact information for our panel tonight. I will forward everyone a copy of the recording for tonight.
Okay, cool.
And then we're also, I'll also send you any links or anything that we mentioned throughout this. So if you didn't write them down or didn't copy and paste,
Well,
don't stress out.
I got notes.
Well, Kathleen, then send me your notes and then I can send them